This is the Cities COVID Mitigation Mapping program. First webinar, we're going to have a series of webinars, and this first one is really focusing on defining the geospatial characteristics of COVID-19 second order impacts. You know, what are second order impacts, and defining them by our different projects and our different partners. And the agenda for today is we'll kick off with Laura Klein, who will give us some opening remarks. We'll go through a few of the some of the things that are going on with respect to the overview of the program, and then I'll pass it off to our partners, where we have a series of presentations along with some videos that we're going to share with you from our partners. I put some Zoom rules here. If everyone who are visitors, if you could go into chat and please type your name and organization, that would be really helpful for us. Also, there's a place for Q&A down at the bottom of your screen. You can go ahead and type your questions in the Q&A, or you can type your questions and comments in chat. Either way, I'll be tracking those, and we'll address those towards the end of the webinar. And then I am recording this. We do have plans to post this somewhere, so just to let you know about that. So with that, I'm going to pass this off to Laura for opening remarks.
Morning, good afternoon, and good evening, everyone. I know we have folks from around the world. Thank you so much for joining us today. As she mentioned, my name's Laura Klein. I'm a geographer at the United States State Department, and our Office of the Geographer is able to pull together this Cities COVID Mitigation Mapping program. And many of you are participating from around the world as part of our hubs and our projects, and we're really looking forward to making progress on all of our projects and getting everything launched, if you will. I think this is really the first time that we have to all speak together, and so we're very much interested and looking forward to what you're going to share with us today. Let me take a quick moment. I know many of us have been working quite a bit on getting this project started and developed since even the beginning of July. So thank you so much for all the hard work that's gone in so far. And we can't wait to see how it's going and hear more. As I mentioned, our Office of the Geographer is pulling this together. We're working with Dr. Melinda Laituri as our principal investigator. She and I have had the opportunity to work together for at least the past 5 years or so, along with your regional hub partners here, to run our secondary cities program, which was also a participatory mapping program built upon and working with local partnerships and enhancing capacities in those communities there. So that was the past. We knew that this is a great opportunity here for us to help impact and support our communities during COVID and help develop mitigation strategies for these second order impacts that we're seeing develop over the past few months. So we're looking into ways of developing data analysis to be able to assess these second order impacts and help understand how we might be able to mitigate these. And then going forward, producing digital map products, data products, assessments, reports, and even blog posts and other ways of communicating the importance, the hard work and dedication, of course, that goes into geospatial data production and analysis to really understand these issues, as well as then being able to share openly the data, the results, and really help inspire others and partner with others and create new networks for expanding this type of work. And next slide, please. So here you'll see the many organizations and entities that have all come together to be a part of this network and this team. We have GGI as our Office of the Geographer, headed by the Geographer of the United States, Dr. Lee Schwartz. He is a strong proponent of our project and our program, and he's been working with us since the beginning. I sit in his office as part of the Humanitarian Information Unit and the director for the program. We have partnerships established with other parts of the department. OES is a strong partner of ours, the Oceans Environment and Science Bureau, of which there are environment, science, technology, and health officers represented at most of the embassies around the world. And those are key focal points for us, and also we hope for the projects as we go along. We have partnerships with USAID for urban and other open mapping activities that take place. We have our mapgive.state.gov website where most of our C2M2 material will go, but also that's kind of the umbrella initiative for all of our participatory mapping. And then we couldn't do this, of course, without our strong partnership with the American Association of Geographers, AAG, that you see here. And Candida Mazzotti has been a tremendous partner of ours throughout the years, and we're looking forward, and we're continuing to work with her now and their team. And then, of course, the regional hubs, whom many of you already know. We have our hub leads for Africa, Asia, and Latin America, and you'll get to hear from them later today. But we're really, really looking forward to how all of this is coming together, and it's really been a large effort, I know, but we know that we're on to something good, and hopefully able to have an impact. On to the next slide for us now, please. So I'll pass it off to the principal investigator for the program, Dr. Melinda Laiteri, and she'll take it away. Thank you.
Okay, thanks everyone. And again, just a reminder for everyone to please sign in the chat and give us your name and affiliation. So a couple of things just to let you know that are happening with the program as we're moving forward with this. We're preparing a C2M2 landing page, which will be part of the MapGive website. MapGive is one of the key activities of the HIU, the Humanitarian Information Unit in the Office of the Geographer. And this will be a great site to be able to be posting a lot of the materials that come out of the project, as well as to share this video on that site as well, that you'll be able to find that here. We've also been collecting a number of publications and gray papers and working papers on second order impacts of COVID, and putting together a spreadsheet of this. And we've had support from this, again, from the Office of the Geographer with Jefferson Science Fellow, Robbie Richardson, who has been working on that for us. And we have a set of students that are also participating on this project with us, with our partnership through the Center of the Geospatial Analysis at Harvard University. And so we have a whole suite of students who are also helping us with defining what are these second order impacts, how might we analyze them using geospatial technologies, and really coming up with some demonstration projects about this that can help to support the overall program and our partners who are out in the field from around the world. And a future webinar will highlight what these students are doing. So just to remind everybody, this is looking at, second order impacts. What are we looking at here? Well, the focus is really on vulnerable populations, urban areas in developing countries, oftentimes informal settlements in those urban areas, and then these long-term and cascading impacts that we're seeing that are emerging from the COVID pandemic. So the emphasis is on considering who has access to social services, what's going on with respect to economic development, how is it slowed down, and where is that impacting people the most? Access to food, do people have it, and what is happening with respect to that? And then how the pandemic is making people move. We may have stay-at-home orders, but we know that things like evictions from places where people live are causing people to go to different places. And we're seeing the collapse of some fundamental social services, and we want to be able to understand that. So we've asked each of the program partners to create a baseline assessment. What is the current conditions in the particular country they're working in, the particular city, and the particular group of people they're focusing on. We need to understand a data assessment in terms of what is the existing data they're starting with. Does the country have some existing information? What is the scale of that data, and how might we fill that gap that exists? And then finally, asking everyone to define what kinds of geospatial technologies will you be using. And those could be anything from a handheld device where you're collecting place-based survey information to a particular software platform that you might be utilizing. And at the upshot of all this is we want to get some analysis using these geospatial technologies that will inform data-driven decisions and how we might be able to understand what comes out of this for the future. We want to assess this over time and be able to have a strong monitoring and evaluation piece of this project, identify mitigation strategies, and come up with some research results. So I've added in here a conceptual diagram, and I know that Robbie is in here. And I'm wondering, Robbie, if you would mind terribly talking to this slide. I'm just trying to make sure that you have the ability to do that. I think I have to give you permission. I'm allowing you to talk.
Thank you. Can you hear me now?
Yes.
So good morning and good evening to everyone who's on the webinar. This is an example of a generalized causal loop diagram. We're using this tool as a way to visualize the ways in which some of these second order impacts of COVID-19 manifest. So you can get a sense of how these causal loop diagrams are intended to convey this kind of this kind of process by looking to the left, where you see the number of COVID-19 cases. As that number increases or decreases, it leads to all kinds of indirect impacts related to the scale of economic lockdown, travel restrictions, hospitalizations, many of those impacting economic activity and employment, ultimately leading to impacts on vulnerable populations, which are a key focus of the program. Eventually, we'd like to develop these kinds of visualization tools for each of the C2M2 projects, because each project has its own second order impacts that are of interest or the focal area of the projects. But we feel like this type of visualization is a valuable tool in conveying or depicting the processes by which these second order impacts emerge. Thank you.
Great, thanks so much, Robbie. Before we go on, I just wanted to make sure that I introduced a few people that I see are in the participant, the attendees list. We have Wendy Guan, she's the director of the Center for Geospatial Analysis and is helping us to oversee the students that are participating on this. Also, I see that Erica Nunez and Tom Burton are also on the call. They're in the Humanitarian Information Unit, are helping so much with our outreach and website construction and helping us with that piece of things and the whole MapGive side of this. And you just met Robbie. And then Candida is also on the call. Many of you know Candida. Candida, where are you on this list? I just saw you there. There we are. Candida, you have to tell me how you say your name.
Candida.
Your last name.
Mannozzi.
Okay, so Candida is so critical to the program also because she helps to manage the administrative side of this with respect to the budgets and the contracts and all the things that are so important to keep it running. But I just wanted to let you know that there's this huge team that's actually working on this on the backside of things and our support for all of you who are part of this project. And I see many of you are on this webinar. Thanks so much. So just to share with you, these are the projects. These are our different regional hubs. And this is a link to our secondary cities project where we have the regional hubs all participated in the Secondary Cities project and demonstrated their abilities that were so successful with respect to the work they've done in their region that we called on them for this project to ask them if they wanted to be the regional leads in these areas and facilitate the C2M2 program in their parts of the world. And they were gracious enough to accept. And within each of these different regions, we have at least one representative city from our Secondary Cities project. For example, in Nepal, which is situated, Kathmandu, which is situated in Nepal, and we have Nama leading that. Our Secondary Cities project from there was a city both in Kathmandu, which was Pokhara, but also Ulaanbaatar. And then in our Africa hub, which Gaston is the lead on, our Secondary Cities there was Pemba. And then in our Latin America hub, where we have Carlos leading that, we had our projects that were going on in Cusco. So we've been able to have this continuity, which I think reflects some level of sustainability for these kinds of projects and demonstrates how we can build on existing expertise and really try to facilitate this kind of work globally and long-term. That's really critical for this. So just as an introduction to all of the different projects, just quickly here to share with you, we have the Africa Hub, and something that's so important for our partners to realize is, again, we're working in this virtual environment. So the more you can share photos and on-site activities that you're doing, the more it can make this alive and be able to have people share and see what you're doing in these different parts of the world. Each of our hub leads have had a launch in their particular locations. And so we've had discussions individually with all of you. And today's meeting is really to discuss and provide this overall view of all of these things. So the launch again for the Asia Hub, we were able to do that virtually as well. And you see this is this environment we're always working in, where we have all our faces on the screen here. And this is something that we just are starting to be getting used to. And we'll have presentations from each of our hub partners. Just yesterday, we had Carlos launch with his team, and it was very successful to meet his team partners as well. And so he'll share some of these things with us today. So with that, I'm going to stop sharing this screen, and I'm going to hand it off to Gaston. And Gaston, you should have the ability to share your screen as you need to, and just let me know when you want me to run the videos.
Okay, thank you so much, Mel, and thanks for everybody who has joined the event. Very exciting. I have a brief 2-minute presentation about the Africa Hub in general, and then we have videos for each of the cities so that we can get a better idea of what's happening in the city and what's coming next. So, can you hear me well? Just make sure.
Yes.
Okay, good. So from an Africa perspective, we do have 3 countries, as Mel mentioned. We have Nairobi in Kenya, we have Bukavu in the DRC, and we have Pemba in Mozambique. And each city has something very unique. You know, Nairobi, it's the capital and a lot of dynamic, but we also have some settlement. And one of the thing that's extremely good for us in Nairobi is the fact that we have a very strong partner who has been working around some settlement. So that gives us a very unique perspective on COVID-19 impacting some of the vulnerable population. When you go to the DRC in Bukavu, Bukavu is at the border of the DRC, where you have Rwanda, Tanzania, and Burundi. So you have a lot of influx of people going in and out. And in fact, when we launched the project, they were the epicenter of COVID-19 in the DRC. Building upon the experience dealing with Ebola and also all the dynamic challenges due to those different population flux, is really going to give us a different perspective on how they're managing the second order impact of COVID-19. And Pemba, secondary city project, also very interesting because it's a port city. So there are a lot of people going there, they're looking for a better life. again, that brings different challenges in terms of managing COVID-19. So that is really a very interesting mix. And also the language. The language in Africa, because each country, in addition to the local languages, they do have, the official language different. In Kenya, it's in English. In Bukavu, it's French. In Mozambique, is Portuguese. That also impact the way people manage things. So it's really interesting how you're going to look at things from there. In addition to that, we realize there are some partners that have done similar projects where we can build upon the experience. So we're leveraging some of the team from the Open City projects, the World Bank, funded project, and they have done a lot of projects around settlement in Ghana. So we're using some of the best practices to make sure that the different countries can really benefit from it. So when you look at each country, the focus is different. In Kenya, we're going to focus on the social impact mostly. So impact on education and some of the impact on the economy. When you look at Bukavu, the focus is going to be on healthcare and education. And in Pemba, it's going to go back to economy as well as some of the educational impact. So each city really has a different perspective, but bring them together is going to give us a pretty good picture and representation of what's happening. At the end of the day, it's all about, as Mel said earlier, let's make sure that we can capture enough geospatial data, and have a good way to manage that information. So we're going to blend the way we capture data. It's really leveraging the 14 categories of human geography, but also tapping some of the SDG goals from the United Nations and world population. The whole idea is to have a set of metrics that will help both decision makers as well as the normal population with regard to decision making, understanding the impact of COVID-19 and how to mitigate those impacts. And in a nutshell, we basically try to create a dashboard, and you're going to see that in some of the presentation, how you're going to look at data from every single category, what are the key objectives, and what are the type of measurement and data you're going to be collecting, throughout the different projects. So Mel, if you don't mind, will you go ahead and share the video from Pemba?
Okay.
I hope the voice is going to be good.
Greetings, everyone. I'm Odisa da Graça, and I'm a part of Pemba team for the project Cities COVID Mitigation Mapping, representing the Catholic University of Mozambique, and I'll be presenting our project summary so far. Pemba is located in Mozambique in Cabo Delgado province, which is in the north of Mozambique. Pemba is a very small district in Cabo Delgado and is also the capital of the province. Pemba is a coastal or port city with a lot of tourism potential and an important sea corridor in the area. Gas resources were discovered a few years back in Palma, a district about 300 kilometers away from Pemba, making the capital city center stage for new companies in related fields to the development of gas exploration and their headquarters, creating new jobs in the city and the province.
Good question, Mel.
So this
We
is
don't see the content. We do have noise.
COVID in Mozambique and in
Okay, I'm getting a message that, sorry, I'm getting a message that you guys can't see this. Is that right?
Yes.
Okay, let me see what's going on here. I just been testing this all morning. Optimize screen.
Did you share the screen?
Here it is. All right, let's try this now. Do you see it now?
Yes. Perfect.
Okay, sorry.
Greetings, everyone. I'm Odisa da Graça, and I'm a part of Pemba team for the project Cities COVID Mitigation Mapping, representing the Catholic University of Mozambique, and I'll be presenting our project summary so far. Pemba is located in Mozambique in Cabo Delgado province, which is in the north of Mozambique. Pemba is a very small district in Cabo Delgado and is also the capital of the province. Pemba is a coastal or port city with a lot of tourism potential and an important sea corridor in the area. Gas resources were discovered a few years back in Palma, a district about 300 kilometers away from Pemba, making the capital city center stage for new companies in related fields to the development of gas exploration and their headquarters, creating new jobs in the city and the province. So this is a few data regarding COVID in Mozambique and in Pemba. In Pemba, we've had 564 cases, 526 recovered, 38 active cases, and 0 deaths. Pemba was one of the first cities to develop active COVID cases quickly, and in June 2020, it was considered a local transmission area, but the cases have gone down significantly, so that scenario has changed. Our focus for this project is mainly on economic and social second impact orders. Our schools closed in the whole country in late March and remained closed until late September. Some schools with online teaching remain open during this time only for online lessons. So in September, when schools gradually opened, it was only for students on grades with exams at the end of the term and for universities. Our borders were closed in late March and opened up completely in September. Few international flights have also resumed, and of course, following all COVID mitigation methods. Tourism activities and businesses were deeply affected at the beginning of the pandemic, but now, since the cases have come down, these activities are going back to normal. Regarding health services, Pemba has the biggest treatment center in the country, capable of treating 200 COVID patients, and it can expand to treating 400 COVID patients. Hospitals and health centers don't let patients with mild symptoms remain there. They ask those patients to follow the treatment and finish the treatment at home with, of course, health professionals accompanying the whole process. So, and there's also very limited access to visitors to any patients of any type of disease in the hospitals. There was no impact on internal mobility pattern in Pemba because we are facing another challenge which is the armed conflicts in the other districts. So we've had many expats leave the city, the province, and the country, but internally, the pandemic has not affected the mobility pattern. Regarding our research difficulties, most available data regarding the pandemic is about the country and the provinces in general. There's not much available information on specific districts. So to overcome this obstacle, work must be done with local government partners to get accurate data regarding Pemba City. And our project partners are Pemba City Council, District Women's Health Services, Social Action, Education Department, Finances and Economic Provincial Services, Neighborhood Secretaries. Our summary of objectives. We aim to understand the current state of the pandemic using a few perspectives on health, education, economy, and social. Our next steps, December 2020, is to complete data assessment, plan data collection, and for January 2021 is to start data collection. Thank you very much, and that's it for our presentation.
Very good. That was the overview of Pemba. So if you don't mind, let's go to Bukavu.
Okay.
It's also a recording, and the last one is going to be a live presentation from Erica.
City COVID.
You have the same issue with
COVID.
Okay, I want to make sure.
Mitigation Mapping Project of Bukavu. Bukavu is located at the eastern part of Congo, bordering with Rwanda. And Bukavu City is the fourth largest city of the country. We can see the location on
Hi,
the
Mel.
map.
We can hear the video, but not see you.
The DR Congo is among the African countries affected
Much better. Cool.
City COVID Mitigation Mapping Project of Bukavu. Bukavu is located at the eastern part of Congo, and Bukavu City is the fourth largest city of the country. We can see the location on the map. The DR Congo is among the African countries affected. The DR Congo is among the African countries affected by COVID-19 pandemic. Its area is about 2,345,410 square kilometers. It has a population at around 96 million. It's about 62% of its population lives below the poverty line, according to the World Bank 2015. The total number of COVID-19 within the 72 hours is 13,281. The total number of deaths is 337, and the recovery cases are 11,753. That is a recovering rate of 88.5%. The country recorded 149 new cases within the last 72 hours. Bukavu City has an area of about 60 square kilometers, and it harbors about 1,078,000 people. That is with a highest, it has the highest among the highest rate of growth rate in DRC, which is about 5.22%. The total case of COVID-19 recorded in Bukavu is 349, from which 72.5% are males, 27.5% are females, and 0% is for children. And the total case of death in Bukavu town, it is 21. Among the second order impact identified in Bukavu City, we can mention school closures, restrictions to travels, border closures, limited access to health facilities, inability or limitation to provide remote learning method, limited access to power. Among the data gap identified in Bukavu, we can mention the geolocalized data of both education and health facilities. There is also the ability of health facilities and schools to cope with COVID-19 pandemic. There is also capacity of household to resist the immediate and long-term consequences of the pandemic. The partners in CC2 Bukavu project include the Faculty of Sciences of Official University of Bukavu, the Department of Biology, the Health Division of South Kivu Province, the City Council of Bukavu City, and the St. Stephanie Clinics. We would like to summarize the metrics which has been considered for Bukavu. Effective pandemic. The strategic objectives is to understand the current state of the pandemic of COVID-19. The perspective of health, with a strategic objective of to look for the impact of waterborne diseases, to mitigate the care, the impact on care and access to care. For the impact of waterborne diseases, the metrics we are going to look at is to look at the access of drinking water and the quality of drinking water in Bukavu City. To mitigate the impact on care and access to care, we are going to look at the access to care, how to reduce the impact of pandemics, how to improve the preventive care. In the perspective of education, the strategic objective is to mitigate the impact of COVID-19 on education. And as metric, we are going to look at access to education, as well as the access to the quality education. For the next step for the C2M2 Bukavu project includes that we are planning to complete data assessment in this month of December. After data assessment, the same month of December, we are planning data collection, and we are planning to start data collection within this month of December. The preparation of data collection, we have organized on the 4th of December, the kickoff workshop with all the stakeholders in Bukavu, as we can see at the last slide, where we have the group photo. In the middle, we have the presentation of COVID C2M2 project Bukavu, and at extreme left, we can see the mayor of Bukavu is among the major partners of Bukavu CC2 project, C2M2 project. Thank you very much.
Very good. So the last one is going to be Erica. She's going to present the Nairobi project. So you might want to make Erica a presenter, Mel, please.
Yeah, I have. Erica, you should be able to share your screen. I think I think Erica is frozen. Oh, there you are. Erica, yeah, there you go.
Unmute. Sorry, I was muted. Do you see my screen?
Yes.
With the slide? Okay. So I'll just spend a few minutes talking about the Nairobi project. My company is called Ground Truth Initiative here in DC. I am working with MAP Kibera as the primary partner in Nairobi. And this is Kibera, the informal settlement where MAP Kibera works out of. As far as COVID-19, you'll see that cases are quite a lot. About almost half of the cases of COVID have occurred in the city of Nairobi for the country of Kenya. And recently there has been an increase in cases, so there's some concern currently about a kind of spike. We are starting out with a focus on schools and education impacts as far as second order. So this is OpenStreetMap. So we primarily work with mapping in OpenStreetMap, and we work a lot with open data. This is actually a zoom in of OpenStreetMap in Kibera itself. All kinds of data there that we've collected over the years. So that's kind of our baseline. And it's not just Kibera. We've mapped quite a bit of Nairobi, especially specific informal settlements. Most of the major informal settlements we've done quite a bit of detail on. So as far as schools data, we have mapped things like and collected data on numbers of students, teachers, costs, feeding programs, which are critical for many families, things like this. So we have a lot of detailed data from prior to the pandemic, which we usually present. This is just drawing from OpenStreetMap data, Open Schools Kenya. So you can see where we have mapped the schools. These clusters are 3 of the major informal settlements. So what we've kind of focused on is the informal schools, and then the government schools and more formalized schools are often there's data on that from the government, but this is the sector that was not captured as well. So we have pretty comprehensive data putting those sets together. Just to show what a kind of school looks like in one of these pages. So the kinds of things we'll be looking at would be number of students out of school, teachers out of work. So we're kind of looking at it as what we will do is remap those schools and survey them as to the impact on, also as seeing schools as businesses, because most of the schools in the informal settlements are small businesses for the owners. So that would cause an economic impact, impacts on families and job losses. So we're trying to kind of tie together the school sector and education sector with the economic sector, and looking across the city. So not just in the settlements, but expecting impacts to be greater there. Far as geography, showing the locations of these shuttered schools, economic impacts, where do they geographically impact the most? We're expecting to see that in those settlements, but we don't know which or how yet until we do this kind of data collection. For example, surveying. We can do surveying of samples of parents, teachers, school heads. We can map the changes as far as open, shut, and numbers of students, teachers, reduction in services in general. We would like to get educational impact data, but I don't know if we'll be able to this fast. I don't know if there's been any testing that can be, that has happened yet. It's kind of, maybe next year there will be testing that will show that. But there probably is some data on students being held back. There will be probably a great number of students that will simply hold back a grade when they restart school, and other related economic data. Other potential impacts that we're looking into studying are things like how the economies are impacted in terms of job losses, business closures, and bar and restaurant closures. We could potentially map that as well, sort of based on with a baseline from prior data. And we also have been doing COVID-19 specific mapping as throughout the year in terms of resources provided, mostly hand washing sites. So there could be a water and sanitation kind of data regarding that, or just COVID resource distribution in terms of what's being provided in the informal settlements. There, one of our partners, Strathmore, has also been working on gender-based violence as regards to COVID. There is also anecdotal and probably hard data on splitting up of families and divorce based on job loss and stress, I'm sure, and economics. So, and then we also have OSM baseline data on all kinds of sectors. So we're still exploring whether we go forward on anything of water, sanitation, or health. These are some of our project partners: Strathmore University, CDC in Nairobi, and RCMRD is a mapping agency in Nairobi as well. Thank you. I think I can stop the share.
Thanks a lot, Erica. And Mel, that closes the contribution from the Africa Hub. Thank you so much.
Okay, thanks so much, Gaston. That was really excellent. And thanks to all the partners for the presentations, and make sure those in Bukavu and Pemba know that we really appreciate them putting their videos together. Next up then is Nama. Would you please present your hub projects?
Yes, sure. Good morning, everybody. My name is Nama Burathoki. I am the director of the Asia Hub for the C2M2 project. Give me a second. Do I have a privilege to share the screen?
Yes.
Okay. In Asia, we do have 3 projects, one in Bangladesh, one in Mongolia, one in Nepal. In Bangladesh, they will be focusing on internal migration. In Mongolia, they will be trying to create a health information infrastructure, not to respond COVID, but for long-term infrastructure to serve what they call a gear community, which is already vulnerable. You will be hearing about these projects in Bangladesh and Mongolia in the video in a minute. So we do have 2 videos. It's 6 minutes for Nepal, and Mel gave me about 20 minutes, and so that means I do have only 5 or 6 minutes. So for Nepal, we do have a project manager, Sajal, who is already here, but because it's too short a time, it's difficult to coordinate among multiple people. That's why I said, okay, I will try to share some of your work from a Nepal perspective, and Sajal happily agreed with that. So the Nepal project is in tourism. Give me a second. I want to share the screen. Can you see my screen?
Yes.
Okay. So Nepal is, people say it's a beautiful country. We attract lots of tourists. So, we do have beautiful Himalayas, including Mount Everest, of course. So please, when you have time, when you plan your vacation, consider to visit Nepal. Maybe after the COVID situation gets better. Nepal also does have several old heritage sites. Only in Kathmandu Valley, there are 7 UNESCO heritage sites in Kathmandu Valley alone. Again, it's tourist country. People, like it. But if you look at some of these numbers, that also tells us quite a bit about why tourism is important in Nepal. These numbers, remember, you need to understand Nepal's economy, to get a sense of these numbers. So Nepal's economy is not that big. So in that economy, about 7% contribution to GDP, about 7% total jobs, 7% of the total job in this sector. In 2020, our government had declared a Visit Nepal 2020. So the goal is to bring as many tourists as possible. So it was a major year for Nepal. But unfortunately, this is what happened. In March, which is about 8-9 months ago, it was already 73% decline in tourism, the tourist arrival in Nepal in March. So of course, I think there was only 1 or 2 COVID cases in Nepal at that time. But now you can imagine the situation now, after March. That means there is no tourists at all coming from other countries. So more than 10,000 businesses have been closed. That's what some of the reports say. Not good. Then how can you understand the impact of COVID in this sector in Nepal? That's a central question. What impacts has there been? So when you talk about tourism, it does have multiple layers, very interconnected. So of course, the hotels, lodges, restaurants, cafes, they get closed. because there are no, you don't have guests, no customers. And then in Nepal also does have, mountaineering. So the porters, you have heard about Sherpas, very, very famous Sherpas. They help you to go to the top of the Himalayas. So, it has impacts in, to porters, trekking guides, to operators, and from there to even small money exchanges and small gift shops. For those of you who have never been to Nepal, you probably have difficulty to understand this. But there are certain areas in Nepal where there are many, many gift shops. So tourists go there, they buy a gift before they leave Nepal and go back to their home. So all those shops have been closed. Now the question is, how do we understand the impact in this very complex sector? It's very number of things that's interconnected, very complex. The question is, even how do we even approach this? To understand. It's one thing to say we want to understand the impact in tourism, but this is a very different thing, to really, get clear, where do you begin? So what we've been doing is, using this concept of what we call a factor map, is just a design thinking tool that allows you to break a big problem into smaller problems. So for example, if you want to understand the impact of COVID in tourism sector, that's a big question. And then you need to understand the impact in business, impact in job, impact in even agriculture. For example, when there is no tourism, no tourists, hotels are closed, and those farmers who supply food, vegetables to hotels, it has effect to their livelihoods. So we are trying to organize this, our thinking, our study. So what we did during the last several weeks was explore, read whatever we get. There are many reports,
Nama,
studies.
your slide's actually rather small. Could you pop it into presentation mode, perhaps?
Laura, I forgot to mention this slide is, I don't expect you to be able to read this, by the way.
Oh, okay.
I just wanted to give you a sense. Anyway, this slide, this diagram, the central question is at the center, of course, and then we do have different branches. We call them A's, and then we gradually reach the nodes. At the node, we do have a specific, we aim to have a specific information. For example, if the node is about, loss of jobs, the guides, for example, how many guides have lost the job, sort of things. So anyway, the idea is we are trying to approach this in a systematic way. So this also contributes to our baseline assessment. So that's where we are. Again, that's pretty much I wanted to share from the Nepal project. So in all of our projects, we are hoping to collect lots of geospatial and other data, of course. And then there will be plenty of opportunity for in the people. I heard from Mel that there are students who are interested to help, and I'm pretty sure there are a lot of opportunities for students to use some of this data to help us analyze. What I just mentioned is about the Nepal project. You will hear now about the Bangladesh and the Mongolia project, and we'll be very happy, if you got interested in any of these projects, if you want to collaborate, if you want to help us, you're more than welcome. So with that, Mel, I haven't looked at my watch. So what I want to do is I want to close, my talk, and I want to pass it to you, Mel, to show the videos. You can go to Mongolia first and then Bangladesh.
Okay, can you stop sharing, Nama? Thank you. Okay, hopefully I can do this better than I've been doing this. To go first to Ulaanbaatar. You see that? Can you see it? Find out in the chat.
Yes?
Yes,
Yes.
we can see.
Okay, excellent. Okay, I'll just.
Hello, everyone. Thank you for being here. I'm going to briefly introduce the C2M2 Ulaanbaatar project from Mongolia on behalf of Public Lab Mongolia. So just a little bit about who we are. We're a local NGO, and our mission is to cultivate healthy environments and resilient communities through open data. And we work towards our mission through long-term programming that promotes open data, citizen science, and community engagement. And as for the C2M2 project in Mongolia, the selected site is Ulaanbaatar, or UB as we locals call it, and it is our capital city. And there are about 1.5 million, which is about half of the country's total population that live in the city. And the city keeps expanding from rural to urban migration. And as you can see, the city has apartment and gear areas. So apartment areas are those that are, apartment buildings that are connected to central infrastructures, whereas the gear areas that refers to traditional housing, as you can see on the photo on the left, are unplanned but not informal settlements that are not connected to central infrastructure, such as heating, running water, or sewage or flashing toilets. And it creates a lot of problems, such as one of the worst air pollutions during the winter months in the world because of the coal burning from the gear areas. And this divide in the city also is a reason for unequal access to services. So this is why C2M2 project was very important for UB. So as you can see on the photo there, on the first top photo, people are fetching their water from water kiosk. And during the pandemic, basic public services such as water kiosks or public bathhouses or family clinics can be high risk areas for local transmission. And Mongolia already has inadequate health infrastructure. On top of it, there are certain part of the population that is having unequal access to health services because they are living on the outskirts or underserved areas in terms of services and infrastructure. And as you know, COVID-19, the coronavirus, is a respiratory disease. And during the winter months, Mongolia suffers one of the worst air pollutions, which also causes a lot of very high rates of respiratory diseases. And this puts the population of the Ulaanbaatar at a very vulnerable situation, especially for the gear area residents. And so the goal of the C2M2 project in Mongolia would be to reduce a secondary impact on health by improving health service access, especially for gear area residents. So within the project, we would like to collect data on available health services, including hospital, clinics, and pharmacies, etc. And then with that data, we would like to create a health service platform and a phone application where people can search and browse and find the type of health service they are looking for, so that they are able to access health services without delay and get the treatments that they need. And we will also be working on vulnerability analysis related to COVID-19 especially for the gear area communities in Ulaanbaatar. So on this map, you can see this is one of a small administrative boundary, and you can see there it's one family clinic. And it's common that, you know, for an administrative boundary with about, you know, 12,000 people on average would have one family clinic. So in terms of data sets, we will be collecting hospitals, clinics, pharmacies, laboratories. We will also be collecting existing information on population demographics, and infrastructure and base data. And then we would be also looking at public service access, such as water kiosks, you know, wash systems, and transportation. And then based on those data, we would be creating a gear area vulnerability analysis and identifying high-risk areas where decision makers should pay attention to, so that these communities can be assisted. And that's the end of my
That's the end. Mel, now you could play the video for Bangladesh.
Hello everyone. Greetings from Bangladesh Open Innovation Lab team. Thank you so much for giving us this wonderful platform to present our project. In our video, we'll be describing our project to you, the importance of this project, and what we expect to achieve from it. When the first hit and the first case of COVID-19 was detected in Wuhan in December 2019, it was beyond our imagination that it would turn into a global pandemic and impact all of our lives so much. And the first case of COVID-19 in Bangladesh was detected in March 2020. And since then, we have been struggling with numerous first and second order impacts of it. As a developing nation, we were already thriving to improve our economic sector, GDP, and living conditions of the low-income communities mostly. But since the pandemic actually hit us, we are struggling to make ends meet and provide for our citizens, especially the most vulnerable, the low-income community. Being a country heavily dependent on our RNG sector and import-export, the entire world's lockdown and lifestyle change has impacted our income-generating sources, and it's leading to socio-economic issues such as lowering of GDP, recession, salary cut, and migration of people from major cities all around Bangladesh. While the major focus of the government and non-governmental organizations are still on the health sector, it is crucial for the secondary impact of COVID-19 to be analyzed and presented in a form that is understandable by not only the government but also all levels of people. This is where the role of geospatial analysis and visualizations comes in the scenario. The basic aim of our project, Pandemic in Bangladesh, and exploration into the socio-economic impact from COVID-19 induced migration, is to geospatially assess the secondary impact of COVID-19 on low-income migrating people, focusing on the capital Dhaka and coastal region. While engaging the relevant stakeholders, we want to prepare a geospatial analytics on migration trends and socioeconomic parameters, which will enrich a geospatial database in support of the project objectives. Now we have a very short presentation that will actually give you what is the current scenario of Bangladesh and what we are doing in the project and what will be the results of this project. So the first we would like to say here what is going on in Bangladesh about the cases. As you can see from the presentation, here the total test is almost 2.8 million The total cases are going high in the linear scale. Currently, we are having approximately 474,000 cases in Bangladesh, and the recovered number is almost 391,000. But the death is also on the rise, showing in the linear scale, and it's currently, as the time of the making the video, is 6,772. The project goal and objectives are we would want to assess the COVID-19 impact on migrating people in the low-income groups. We would like to explore the socioeconomic challenges faced by the target groups, and we would want to prepare a geospatial analytics on migration trends and socioeconomic parameters to enrich the GIS database, as I've said before. And we want to engage the relevant stakeholders to devise working outputs and escalate as a knowledge-generating partner. And at the end, last but not the least, we would want to create a map and mappers platform on the OpenStreetMap platform to enhance resilience and have a community that would know what to do with this open data that we will be providing at the end of the project. The expected results of this project is that we would want to actually unravel the underlying causes of the outbound mass migration of working people, and especially to the vulnerable community migration to the coastal belt. The focus group discussion and stakeholder discussion will provide us with the qualitative data that will be actually giving us the entire scenario of COVID-19 affected socioeconomic situation, and mostly of the capital in Dhaka, and where we will be aiding to the works of government organizations and non-government organizations who are working to ensure the livelihood of this marginalized community that we are focusing on. We would want to integrate social science and economic scholars of the country in this project and have a rapid overview of the socio-economic impact on the ongoing health emergencies and its inevitable impact on most vulnerable groups and other sectors among city populations. We would be identifying the vulnerable areas while gathering real-time data, and then we will be enhancing resilience through capacity building. And that would be all from us till now. We are currently on, we have just had the project launch, and with a very good kickstart, we are doing our project work and baseline assessment. We are really hoping that through this project, we will be helping the vulnerable communities of Bangladesh, and we can do something impactful for their lives. And this secondary impact assessment, we are hoping to have a significant impact on solving the problems of their lives and creating a milestone in Bangladesh geospatial analysis projects, so that this kind of project can be done in the future too. We will love to actually have your suggestions on this. We would want to know what your thoughts on this. So please feel free to reach out to us if you have any suggestions regarding this. But we are really looking forward to to carrying out the project and sharing the findings with you all. Thank you so much for giving us the platform to share our project, and we hope to see you all soon. Thank you.
Okay, Nama, thank you so much for that overview of everything from the Asia Hub. That was really quite helpful. Please make sure if our colleagues are not on the webinar to thank them for their excellent videos and for giving a really good overview of their particular projects. With that, I'm going to shift now to our Latin America Hub. And Carlos, it's in your hands now.
Thank you, Melinda. Thanks, everybody. Can you see my screen?
Yes, we can.
Thanks a lot to the organizers of this first meeting. And I really would like to showcase the projects of and the problems that we face here in Latin America related to the pandemics. We are a hub working across the Latin America region with several universities, which include Universidad Peruana Cayetano Heredia in Peru, Universidad Federal de Minas Gerais in Brazil, Instituto Milenio in Chile, and the Universidad San Francisco de Quito in Ecuador. And one of the most important reasons of why we choose to develop this project is that the Latin American region has been very affected by the pandemics, directly in terms of disease and deaths, but also related to the cascading effects of the pandemics in the economy and the society, like what we are calling now the secondary order effects. And here we can see updated data in terms of deaths of patients diagnosed with COVID. And more or less, we can see that the trend in Latin America is not decreasing much. We are about 1,700 deaths per week, and which now, compared to other regions like Europe, is relatively small. But in terms of percentage, Latin America still has a very big chunk of the deaths across the globe. And the problem is that our health systems, probably related also to poverty, are not well equipped. As you can also might know, Latin America has a high level of inequality across the countries. And here we see a map of the deaths per 100,000 people. Most of the countries that are involved in this project have a high death rate in terms of COVID. And this just to illustrate how bad is the problem that we face in the region. So we chose the 6 cities to develop the project. Quito and Lima and Santiago are the capitals of the country, so big cities, or relatively big, especially Lima and Santiago, real poles of development. And then we have Ouro Preto, Cusco, and Santa Cruz that also are poles of development related to the tourism sector. So I think we have here a good, in terms of the cities, a good way to compare and to contrast also ways on how the cities are adapting and probably creating resilience to the COVID, and how we can exchange and learn from each of the cities. And I apologize for not having videos for each of the cities. I'll just promise my Juan Pablo Luna, our colleague from Chile, that next time we'll have really nice videos. So for now, it's just me talking. And so we have 3 projects that combines the cities. And the first one is mapping urban poverty in the Andean region, especially Quito, Lima, and Santiago de Chile. And then later analyzing mobility and migration in the same cities, Quito, Lima, and Santiago. And we want to focus especially on the Venezuelan migrants. We'll have the opportunity to see some of the figures there. And then analyze the consequence of the collapse of tourism in the economy and the indirect consequence in society and environment. And we'll do that in the cities of Ouro Preto, in the state of Minas Gerais in Brazil, Cusco in Peru, and Santa Cruz in the Galapagos Islands, Ecuador. What we intend to do is map target populations. vulnerable populations that probably are scattered in the cities and that probably are invisible to a series of actors, including the local and national governments. We want to do this using interviews, household surveys, remote sensing, and secondary data analysis. We want to also illustrate some processes using dynamic systems, very similar to the models that Robbie presented earlier this morning, today. And the idea at the end, what we want to do is to create spatial explicit scenarios of the future that might impact public policy, how policymakers see this vulnerable population of these vulnerable places. And most of us are professors or students in our group. We want to create new methods, improve methods, and disseminate these methods and this analysis. So here just some of the things we do, like interviews or household surveys. Most of the problems related to this type of data collection, as you can imagine, is now related to the COVID. We don't have the opportunity, or are not going to have the opportunity, to go to houses or to neighborhoods to ask directly, because the COVID pandemics make it very dangerous for the interviewers, but also interviewers can be vectors of the disease. So we are going to see, wait and explore how the next months are going to be. If not, we'll change, adapt to interviews via internet online. So let me talk a little bit about the second order impacts in our region. We are very concerned that the cascading effects of COVID into the socioeconomic system and even in the environment are going to be really big in the next years. And this is related to poverty, and especially the redistribution of extreme poverty inside of our cities. Inequality, most of our cities are very unequal, where we have clusters of lack of services, insecurity, while other parts of the cities work or function more like a bubble. And forced migration of mobility, food insecurity, lack of access to education, emergence of violence and other illegal activities. So there is a large number of secondary order effects. We have chosen just some of these to develop our projects, but it's really hard once we enter the topics to just stay in one effect, because everything is connected, as you can see. So let's explore how migration and what I'm calling this spatial rearrangement of poverty will work in our projects. As you probably know, there is a lot of immigration from Venezuelan migrants across Latin America. And one of the interesting parts of this project is that it will allow us to compare and to analyze these fluxes and how Quito, Lima, and Santiago are reacting to the influx of migrants, but also to the temporary or permanent mobility caused by the pandemics. In Ecuador, we have about 330,000 migrants. Peru has a very large numbers of 861,000. Chile has 288,000. migrants. This just before the pandemics. And the idea of this project is to try to understand how the pandemics affected this vulnerable population, but also try to understand how these depressed urban areas expelled these migrants. We can see now large amounts of Venezuelan migrants returning to their country. So the circumstances from this vulnerable group are relatively similar. For example, in Peru, just 13% live in poverty, 4% in extreme poverty. And only 6% of these people work as regularly, legally. So the conditions they face when they are in these receiving countries is very bad. Also, the number of infected is really high compared to other groups. The idea of this project is that these groups, which are highly mobile, can adapt and rearrange the maps of poverty across the regions. And this is something that we want to see. And one important component of this project is that we want to use usually methods that are not very widely used to study mobility or migration. Here we are using a sensor called radiometric suite day-night bands from DMB. It has a spatial resolution of 450 meters. And so what we are looking here is the night light from each of the cities before and after the lockdowns in the pandemics. And we will be able to compare how some precise neighborhoods that are sending migrants where there is out-migration will behave. So we are thinking that we are going to correlate, or we will successfully correlating the intensity of the light, the use of the electricity with people who out-migrate from these places. And we are already doing this. A second factor affecting or cascading secondary order effect is urban violence and intrafamily violence within our cities. And this just to illustrate our point, the example of Santiago de Chile, which our colleagues Juan Pablo Luna presented also yesterday. I thought it was a nice example. So here are the cases of COVID-19. In Santiago, another type of vulnerable population, people older, I don't know, older than, well, just older, I guess. And here, the quality of the households, an indicator of poverty. And here also we can see another indicator of extreme poverty. These are communal kitchens to feed poor people, which probably are living in need. And we can see already some of the clusters of these red dots across the city also overlaps with vulnerable places. And what I think is really interesting is these places of social tension across the city, how these overlap with the vulnerable populations, with the emergent places of the disease. So just mapping the structure, and with these few maps, we can really see the linkages between different factors. Another problem that we will be analyzing in this hub is the collapse of tourism and the tourism industry and COVID. Here we are analyzing 3 beautiful places, amazing urban areas and natural areas. The 3 of them have been categorized by UNESCO as World Heritage Sites. Cusco probably concentrate the history of the Inca Empire. So one of the preferred areas in Latin America for visit. And then we have Ouro Preto in the state of Minas Gerais in Brazil, who also has one of the best kept colony cities in Latin America. And then we have the Galapagos Islands, who have a very rich nature because of its isolation is a laboratory for evolution. Unfortunately, these cities also depend a lot, almost completely, on tourism. Some of the cities more, like Galapagos, Santa Cruz in this case, almost 80% of the economy is related to tourism. So there has been a complete collapse, almost complete collapse of the economy, while other cities like Ouro Preto, it has a more diverse portfolio of economic activities, including mining. So in the case of Ecuador, this is the pre-pandemic increase. So you can see it's almost an exponential increase of tourism arrivals. And while economy is trying to recover from this deep shock, we can see that the recovery will also depend on the type of visitors trying to return to the Galapagos. So as you can see here in Ecuador, we have visitors from different sending areas, different countries, and mostly from the US and Europe returning. So everything about the recovery is going to depend on how these markets are going to behave. So here we can see, the number of tourists and how the pandemic really, collapsed the number of tourists and different types of scenarios of recovery. How these scenarios are going to work will have a lot of impacts in the carrying capacity, in the invasive species, in the local expenditure, how much money is going to come back to the local populations. So we are trying to understand that in different ways. But most importantly, for now, what we are trying to understand is how this collapse has affected different components of the socioeconomic system. How this collapse, for example, is going to fuel different types of illegal activities, such as illegal wildlife trade, but also how it is going to affect families via intrafamily violence, drug addiction, and illegal activities. So this is for now. We want to give you. We wanted to give you a broad spectrum of the things we are going to do, and I'm sure Alison and Juan Pablo, who are also part of the project, Braulio, we'll have more comments at the end. Thank you so much, Melinda, and everybody.
Excellent. Thank you so much, Carlos. That was a really good overview of the issues in Latin America. And just a reminder, the purpose of this particular webinar was to tease out what are the second order impacts of COVID. And I think all of our regions really came out with an excellent description of how we understand these second order impacts. The next stages are really teasing out these details of what are the data that are needed, how are we collecting them, and how are we analyzing them. So the purpose also of this webinar is to create this shared collaborative learning experience amongst our partners around the world. So you can see the commonalities in terms of these different thematic areas that you're looking at and be able to reach out to each other to understand and to share what you're learning about. We know that these are complex and difficult issues. However, they all have this strong, this very strong geographical component. And so being able to tease out that geospatial aspect of this and being able to analyze it is something that's really critical for moving this forward to the decision-making realm. But in the first instance, what this provides us, and this is really exciting, is putting together the research that's going on right now, the science behind all of this with the community activities, and you facilitating this connectivity. Connectivity is this key word here between science and communities. So we have this rich array of articles that have been collected of the research that's coming out of these activities that are going on around the world that Robbie has been so central in putting together. And I noticed that Sebastian's also on the line here. So just wanted to shout out to him as well for helping with putting that resource together that looks at these analytical methods for how we assess geospatial data. And this is going to be the next step where we try to bring all of these things together in terms of using that causal loop diagram to understand the connectivity of these different things that are going on around the world and being able to come out with some kind of analysis on this. So kudos to you for this first webinar and putting all of these things together. And just a reminder to all of you, I have your videos, but I'm going to want all your PowerPoints too. So make sure you get them to me or upload them to the shared Google folder. We'll figure out a way how best to share all these things with the people that will be interested beyond just our community here. And with that, I'm not sure if we have many questions in the chat, but I'm definitely opening it up for questions now. If anyone wants to post anything, I don't see anything in the Q&A, and I don't see anything amongst the comments here. Most of them are just saying, wow, how interesting this all is. What a great job everyone did. So with that, Laura, do you have any comments?
Well, just to thank everyone for their participation today, and thank everyone for these presentations. It's very fascinating to see. And again, as Dr. Laiteri so well put it, to kind of tease some of the commonalities, identify these second order impacts that are greatest at the community level, but also then from a programmatic side, we're looking at those that build up from community and region and maybe across the whole program, trying to tease these out. Again, you know, we're looking for opportunities and we're looking for continued collaboration, of course, on how we can help publicize and share the information and the activities that are taking place. Our C2M2 web pages will be launching very soon under the mapgive.state.gov website. That will include Dr. Richardson's and Sebastian Viscuso's second order impacts lit review that has been done. That's already available to many on the call via a Google Sheet, but it will be launched on the website. That'll be open publicly and available. And then, as Dr. Laiteri said, that will be a place where if some aspects of today's recording or these presentations are something we wish to put and make publicly available, that will be another way which we can further amplify the great work that you're doing and the really important activities that are taking place and the lessons that we're learning on how mapping geospatial approaches and this data-driven activities can really have influence and make an impact for mitigating COVID second-order impacts and for decision makers. So thank you all for your time today, but so much for all your hard work to this point and as we continue on. That's all from me, but thank you.
So just to follow up, there is a question in the Q&A now and asking about, kind of comparative study cases that are going on in Latin America and thinking about how future to integrate some of the results from the Africa and Asia hubs. Maybe a journal paper can come out of that, and by all means, we want to facilitate that kind of interaction across the globe to write up this material. And, in the first instance, we will want to be putting together white papers and things that are easy to get out in a quick way, but to build on that and be able to have, scholarly journal articles come out of this would be very valuable to have happen. But we also want to be able to get this out quickly. And that's why white papers can get out there in a way that decision makers can have access to what we're learning right away. So thank you for that question. I'm just sort of checking here to see if there's anything else I might be missing, either in the Q&A or in the chat. And I'm not seeing much here, but wait, I think maybe someone might have their hand raised. Elisan, you can unmute. I think you can go ahead and talk. I've given you permission.
Okay, can you hear me?
Yes.
I'd like to thank you all for the fantastic presentations. I really like this. I have been in Nepal, in Kenya, in Mozambique before, and seeing this study case is coming out. I mean, it's fantastic. I wrote that question about the possibility of a global comparative study case and a white paper or journal paper. I think that would be really fantastic, doing some sort of meta-analysis or something like that. And I'm sure that here in Brazil, we will be very glad to collaborate on that in the near future. So thanks a lot all for the presentations, and I hope you can meet all you sometime after the social isolation physically. Yeah, thanks a lot.
Excellent, thank you so much. Just to let you know, we will have a series of webinars, and the next webinar will not be till after the new year. We hope that everyone will enjoy the holiday season, end of the year, things that are going on, and that you're best able to celebrate as well as we can during this difficult time. What I do want to emphasize is this is a global event that we're experiencing, this pandemic. It's also a communal event. We will all remember the year 2020 and how it manifested itself, and it's had an impact on all of us. Although the geography may be different and the local conditions may be different, this is a shared collective experience, and I think we have an opportunity here to think about how we move forward and how we build community in the post-COVID world, which gives us gives us more opportunity than we may think. And there's more silver lining in this than we may think. And so I guess I'm thinking that we can be optimistic with respect to the abilities of what we can learn here. And again, I would emphasize the number of young people that are involved in this activity that we're engaged in. They're the ones who are going to lead us out of this eventually in that long-term trend. So with that, I'm not seeing any other, did I hear somebody talk? Okay. Okay, so with that, I'm going to call the webinar to a close. And thank you all for your time and attending. And well, I think this went pretty well. So thank you all very much and have a very nice rest of the day or
Thank
evening.
you, everyone. And if we are talking sooner, happy holidays to everyone, however you may celebrate. Thank you.
Thank you too.